Buenas tardes con todos. Mi nombre es Rosa Sandoval. Soy la jefa interina de la unidad de factores de
Good
riesgo.
afternoon, everyone. This is Rosa Seveda from the Department of Non-Communicable Diseases and Mental Health at PAHO. It's a pleasure to have you with us today. And this is our webinar, Front of Packaging Labeling as a Policy Tool for the Prevention of Non-Communicable Diseases in the Americas. And it's a pleasure for us to launch a publication by PAHO on this topic. To begin with today's webinar, I would like to invite Dr. Hansel Hennes, who's the Director of Non-Communicable Diseases and Mental Health Department at PAHO, for his opening remarks. Go ahead.
Well, good afternoon to all. It is indeed a privilege and a pleasure for me to welcome you to this launch of front of package labeling as a policy tool for the prevention of non-communicable diseases in the Americas. As you know, supermarkets are crowded with thousands of items and shoppers spend only a few seconds in making a selection. Too little time to find out whether the product is good for their health or contributes to problems such as high blood pressure, high blood sugar levels, and overweight obesity, which are responsible for almost half of all deaths in the Americas. They need help with these simple yet profound decisions. And this is even more important in the current context of the global pandemic, where persons with non-communicable diseases are at greater risk of becoming severely ill and dying from COVID-19. And in our region, about 1/3 of the population, that is 325 million people, has an underlying condition which increases COVID-related poorer outcomes. The loss of life and years of life lived with disease or disability due to non-communicable diseases not only impacts health, but also human and socioeconomic development. Unhealthy eating is closely linked to hypertension, diabetes, and obesity, and is driven largely by the high intake of processed and ultra-processed food products that are excessive in sugars, fats, and sodium. The majority of populations in our region and worldwide still lack access to simple information about whether a product is excessive in sugars, sodium, saturated fats, trans fats, or total fats. The solution is a clear, quick, and easy warning label on the front of the package, providing comprehensive information. Chile has pioneered the use of warning labels globally, and as robust, reproducible scientific evidence has continued to evolve, other countries such as Mexico have implemented a similar labeling standard, leading to this country's recognition internationally for this public health milestone by a prize presented by the United Nations Interagency Task Force on the Prevention and Control of Non-Communicable Diseases. There are also advances in the Caribbean subregion as well as in Argentina on comprehensive labeling standards to protect health based on PAHO and WHO recommendations and on the best available experiences and evidence. The accumulated best practices and the willingness of countries of the Americas to upgrade policies to improve diets in order to protect public health were factors that motivated this publication. This report documents and supports the work that you, the member states, have been carrying out and your accomplishments. We hope that this work continues to better equip our member states to save lives, reduce the burden of illness, and improve the quality of life in the region, as well as protect our human rights and those of our children. I'd also like to thank our distinguished panelists for taking time to share their views on the application of this new publication, and look forward to the full engagement of all who are participating. Welcome.
Muchísimas gracias, Ansel, por esas palabras de apertura.
Thank you very much, Hansel, for your opening remarks. And now I would like to move on with the agenda, but before that, I would like to give you two warnings. First of all, we have 289 participants, so thank you very much to all of you for joining us. And as you can see, we're We have a simultaneous interpretation, so you can select your preferred language for this session. And if you're bilingual, you can just leave the interpretation icon on off. If you have questions or greetings, like I see that several of you are writing from Ecuador, Dominican Republic, Canada, etc., for any messages to that effect, you're welcome to use the chat. And now for the questions that you may have for our panelists, we kindly ask you to use the Q&A icon where you can write your questions, and we will try to answer those questions either in writing or at the Q&A session at the end. Today, we're basically going to have 4 additional sections or sessions, and now my colleague Fabio da Silva Gomes, Advisor for Nutrition and Physical Activity Advisor, will present today's publication, and then we'll have a dialogue with a significant number of panelists and experts throughout the region that will talk about this topic from different areas, the nutritional aspect, the economic aspect, the legal aspect, and then we will move on to the question and answer session and finally closing remarks. So if you have any questions or comments either on how the system works or anything else, you can write it on the chat. And if you have any questions for our panelists, you can use the Q&A icon. Without further ado, I'll give the floor to Fabio. Thank you, Rosa. Thank you, Dr. Hennis, for your remarks. And I would like to begin by thanking everyone. We know we have people connected from everywhere in the region and the world. We have a large diversity of participants in this session, so it's a great pleasure for us to see how much interest there is on this topic and how much it has increased, how important it is to have front of package and label as a way to prevent non-communicable diseases. And I will talk about the structure of the document, not so much the content that's included in the information that you receive. We have both links to the publication, English and Spanish, and I would like to talk a little bit about how this document is structured, as well as some of the key aspects to highlight, to then talk about the use and usefulness of this document, as well as why we decided to put this document together. As far as the structure goes, the document begins with background information where we show how the issue of NCDs impacts our population, and then we talk about front labeling systems, the purpose of the labeling system, performance measures, nutrient profile model, and then it goes on to a frequently asked questions on front of package nutrition warning system for the prevention of non-communicable diseases. And as far as the purpose of labeling systems, it refers to the elements that identify the different purposes, because we know that there's several labeling systems, so it wouldn't be very efficient from a political decision-making point of view to go and compare each one of those systems. Therefore, it's important to, first of all, identify the different systems so that we can choose the one that can best meet the prevention of non-communicable diseases. And then
now I'm gonna switch to English, so we're sure that we have, and if you want to access the different languages, you can access that. And in the part of the performance measures, we not only identify the products, the systems according to which purpose they intend to fulfill, but how they fulfill the purpose that in our region is the most in need, which is to advise, to allow populations and consumers to quickly, easily, and correctly identify the products that are excessive in sugars, fat, saturated fats, trans fat, and sodium. En una otra sección que hablamos resumimos la importancia del modelo de perfil de nutrientes.
We also summarize the nutrient profile model and how the different products are classified, as well as the criteria that need to be adopted, especially for the ones that need to have the warning label, and then the model for PAHO, the importance of adopting them so that we can have a warning system that can change the buying decision as well as diet, because we may change one single decision at the time of purchasing a product in our consumer, but this change doesn't necessarily result in a change in diet. So it's very important for our profile model to be well established.
A section on frequently asked questions. And in that section, we deal with different sorts of questions that emerge from different countries, and that have been accumulated from the work that we'll be doing with countries in supporting them securing the front of pack labeling in different parts of our region. And some questions relate to the performance of the nutrition warning system and alternative front of pack labeling system. So they are focused more on the results. Then we have a set of questions that are more on the other systems and why the other systems do not fulfill the purpose that we are intending to help preventing non-communicable diseases. So the purpose of allowing consumers to identify products that are excessive in sugars, sodium, saturated fats, trans fats, and total fats. Then there's in another session, we deal with the PAHO nutrient profile model. In many countries, we hear the argument that the PAHO nutrient profile is too rigorous. So we explain that the nutrient profile model of PAHO is not designed to be less or more rigorous. It's just based on the WHO recommendations, and we'll have time to discuss this a little bit more during our panel discussion. And then moving on the other section of the questions and answers, we move to a whole different section that is more about the policies and some considerations about the policy adoption or policy implementation, such as, in this case, how Codex Alimentarios could or not impede or would or not impede countries to take their own front of pack labeling systems. So questions that are very commonly heard from our countries, and we put them together here so that's clarified for all countries. Then there's one before last section that relates questions that relates to economic considerations. So what are the cost implications? What are the implications for the economy and trade? And finally, one session that refers to las consideraciones, una última sesión que se refiere a las.
There's a final session that refers to legal considerations on international trade. For example, whether we foresee that nutritional warnings will impact free trade or transactions between trade partners. So we deal with these different questions that the countries pose for clarity purposes, and so that we can make progress in public health in order to reach the best possible standards, both from the point of view of the policy tool itself, as well as the criteria that are used to define what products should be regulated under this warning system, or other policies that refer to front of package labeling, such as advertising regulations, regulations around schools, as well as taxes on sugary drinks and other products. And with that, we can move on to the next part of the session. The idea was to give you a big overview on how the document is structured, and so that you can have an idea, for those of you who haven't read it yet, of what you could find in the document and have a chance to now talk with authorities and experts on the matter so they can talk about the use and the usefulness of this document for our countries, but also to hear about the different advances that countries have made in our region, and as well as the science that has been built around front of package labeling, the criteria that are used to define what products should be regulated, and all the implementation science that was collected in countries that have pushed for front of package labeling regulation in our region. And with that, I would briefly introduce our panelists, and you can start turning your cameras on as I introduce you. But I'm going to now read the list in order, alphabetical order by first name. We're going to have Bern Grady, who's a technical officer, a legal technical officer from Non-Communicable Diseases Department at the WHO in Geneva. Hi, Ben. We also have Professor Carlos Monteiro, who's a member of the WHO Nutrition Guidance Expert Advisory Group. Good afternoon, Carlos. And we also have the distinguished presence of the Deputy Secretary of Health, um, Commerce and Competitiveness in Mexico, Dr. Ernesto Acevedo, Deputy Secretary of Industry. And we also have Professor Guillermo Paraje, an economics researcher who is joining us from Chile. Thank you, Guillermo.
We also come with the presence of Holly Wong. She's the Vice President of the Global Health Advocacy Incubator. Good afternoon, Holly. También contamos con la ilustrísima presencia del doctor
We
Hugo
also
López,
have distinguished presence of Mr. Gatel
de México.
from the Department of Health in Mexico.
Creo que todavía no
That was Hugo López Gatel, Deputy Secretary of Health Promotion and Prevention. He has not been able to log in yet. And we also have Juan Carballo, who is Latin American Global Health Advocacy Incubator Advisor. And we also have the Honorable Senator of Argentina, Engineer Julio Cobos, who's a national representative for the province of Mendoza, who co-authored a bill on front of package labeling for advertising and school purposes. He also chairs an association in Argentina, and he's senator for the province of Mendoza. Thank you very much for joining us. And in this panel, we also have an advisor on human rights, Dr. Alejandro Morlaquete. And Alejandro and I will be moderating this debate, this dialogue, where we will hear the experience from our countries through our panelists, and we're also going to hear about the science of us developed and that underlies the recommendations that are summarized in this publication. I would like to begin with by thanking and congratulating Mexico on the award that you received from the United Nations for ensuring front of package labeling, which was a big achievement. And I would like to ask Ernesto to talk a little bit about why Mexico adopted that front of package warning labeling system, as well as recommendations from PAHO and WHO to define the criteria that we have in writing. And I would also like to tell a little bit about how we're moving towards implementation in Mexico. Thank you. Go ahead, Dr. Ernesto.
Thank you very much. It is a pleasure to join all of you this afternoon and to be together for the launching of this publication. It is very important for all of Latin America. The topic is a very important one, and I think that Mexico is a good example, not only of the importance of the subject matter, but also to point out the serious nature of some numbers that we have, not only in terms of overweight and obesity, but also in the costs produced by the epidemic. In 2016, the federal government of Mexico recognized that Mexico's population was going through an epidemic. It was a recognition. It is something that was part of an official publication acknowledging the existence of that epidemic. But since that time, between then and the beginning of this administration, there had been very few steps taken to deal with that epidemic. When this administration took office under President López Obrador, there was a clear objective set, not only in the vast overview of public policy, which is to support the poorest sectors of society, but also to find things that could create the well-being of our population. Mexico has one of the highest figures of overweight population. And I think that there is something that the Secretariat of the Economy has done in terms of front of package labeling. We calculate that annually Mexico loses about 5.3% of its GDP, which go to medical care and the indirect effects of obesity. So 5.3% of GDP, and that loss would continue over the next 30 years, according to the estimates. So not only did we have the health issue, but also the fact that it had economic repercussions, and this had to be tackled immediately. One of the most important findings in this process is that obesity, not only is it very costly economically, as you can well imagine, this produces high healthcare costs plus indirect costs, which affect people's productivity. But also, in addition to all of this, and this is tremendously important, especially under this administration, which stresses inclusion and leaving no one behind, there are some estimates that indicate that obesity decreases Mexicans' life expectancy by 4 years. Now, that is catastrophic. And also, we look at school achievement on the part of children and adolescents that are obese. OECD calculations calculate that school performance is 13.5% below that of children of normal weight. There's something else too, and it is that obesity worsens inequality, not only economic inequality, but in terms of gender equality. Economically, because those segments of the population that earn least suffer more from the epidemic when compared to the high-income sectors, and there's a distinction between males and females. Unfortunately, females suffer more from overweight and obesity. So regardless of how we looked at this situation, we realized that the government of Mexico had to take action. And that is something that we did with legal norm 051. That is not only a front of package warning system. And here I wanted to say that here 2 aspects get combined. First of all, the fact that we have to protect the right of consumers. Consumers need to have true, straightforward, timely information. They need to know what is in the product. And also, there is a warning on nutrients that are high. That would be sodium, different types of fat, etc. And all of that is very, very important. Plus, also precautionary labels in terms of caffeine and sweeteners that are not recommended. So we have to focus on protecting consumers' rights, but also as authorities, we have the obligation to warn if we detect any risk. The consumer, and this is something we know, these are adults, they can make their decisions freely, but authorities have the obligation of warning in a timely way, giving true, straightforward information that can be understood by a broad group of the population. And that is exactly what we are pursuing in this legal action taken by Mexico. Thank you very much. Considering what you just said, not only do we have to see how Mexico is keeping a consumer well informed, but also it's interesting that you adopted the recommendations. You said what criteria had to be followed to regulate these products. So I would ask Dr. Carlos Montero. He has participated in the nutrient profile of both the WHO and PAHO, and Carlos Montero is an advisor and part of the advisory panel. So could you tell us a bit about the science behind the nutrient profile model of both WHO and
Muchas
PAHO?
gracias, Fabio.
Thank you, Fabio.
Un placer estar aquí.
It is a pleasure to be here with you. I wanted to begin by congratulating PAHO on this excellent document. I am certain that it will be very helpful to our
El
region.
perfil de la OPS de nutrientes tiene
PAHO's
dos
nutrient profile
características que
has
son muy
2
importantes
characteristics that are
y
tremendously
voy
important,
a explicar
and I want
rápidamente.
to
La
explain
primera
what I
característica
mean.
es que los
The first
nutrientes
characteristic
que
is that
elegimos
the
y los
nutrients that
niveles
we
críticos que
choose
elegimos
and the critical levels that we
están
chose
alineados
have to be
perfectamente con las
perfectly well aligned
recomendaciones de
with
la OMS
the
para la
recommendations
dieta.
coming from WHO in terms of
Y
diet.
sabemos que las
We know
recomendaciones
that
que OMS hace para la dieta
WHO's
está
recommendations
regulada
for
por todo el
diet
proceso de todos los
are
guidelines que OMS
regulated
publica.
and they follow
Ellos son
all of the
basados en
guidelines
evidencia
published by
y siguen
the World Health
una
Organization. They
metodología
are
muy rigurosa
evidence-based and
que se
follow a
conoce
very
como GRADE,
rigorous
y es una
methodology. It's
metodología
called
que
GRADE,
involucra
and it is a
cuestiones que son
methodology that
formuladas por un
involves
grupo de asesores, de
issues that
consultores.
are discussed by
Estas
a group of
preguntas después
advisors.
van a revisiones sistemáticas de la
After this
literatura que
is
son
done, there is a
encomendadas a
systematic
expertos
review
en
of the
la área.
literature that is
Estas
entrusted
revisiones
to
son
experts in the
discutidas otra
area.
vez
Those
y todas las
recommendations are discussed
recomendaciones son
again,
basadas
and
en
all
las conclusiones de estas
recommendations
revisiones
and the
sistemáticas. Y
conclusions
lo que es muy
are
importante es
systematic
que
in nature.
el
An
alineamiento es
important
completo.
thing is
Así que
that the
la
alignment
OMS
is
modifica una
very
recomendación
thorough.
porque surgen
So
evidencias
WHO
nuevas. El
issues a
perfil de la
recommendation
OPS
if there are new
cambia
profiles,
en
but
conjunto. Así que
that
está
means
totalmente
that
basado en
PAHO's
evidencia
profile would change
y
at the
basado
same
en
time.
evidencia de
So
alta
all of
calidad,
this is evidence-based and based
validada
on high quality
por la
evidence
OMS.
that is
Una
validated by
segunda
WHO.
característica
Then
importante
a second important
es
characteristic
que
is that
para todos los ítems de consumo alimentario que son
everything
considerados en el perfil hay una única
that is
recomendación.
dietary consumption. There
Encontramos en otros
is one
perfiles
recommendation. In
de
other
nutrientes, a
nutrient
veces
profiles,
niveles de
sometimes
sodio,
we
por
find
ejemplo, que son
sodium
aceptos
levels,
para
for
algunos
example, that are
productos,
accepted
son
for
más
some
bajos, para
products,
otros son
and
más
there
altos,
they are
y
lower
sin
in
haber
one
ninguna
case, in
evidencia
another
de
case they're
que
higher,
el
but
exceso
without there
de sodio
being any
pueda hacer
evidence that
efectos
the
distintos dependiendo del
excess
producto.
sodium
Así que el perfil
intake can
de
make a
la
difference in
OPS
terms of using that product.
tiene los
So the
nutrientes de los
WHO
niveles
profile
críticos que son
has the
únicos
nutrients
para
and
todos
the
los
critical levels
alimentos,
that
pero con
apply
la
across the board
importante
to all
condición que
food.
hay una
Now,
excepción
here there is an
de
important
dos
condition,
tipos de
and that
alimentos,
is that
los alimentos
we
frescos
emphasize
y los alimentos o mínimamente procesados
two
y a los
types
ingredientes
of
culinarios
food,
procesados.
the fresh
El
elements
perfil
and
de OPS
foods that are
es aplicable
very little
a los
processed.
alimentos
So that
procesados y
profile,
ultraprocesados. ¿Y
the
por qué
profile
eso?
of
Porque
WHO
los
applies to
procesados y
processed and
ultraprocesados son
ultra-processed
alimentos
foods. Why?
añadidos
Because
de
those
estos
are the
nutrientes, la
foods
sal o la
where
grasa
salt
o
or
lo que sea.
fat
Entonces, si
are
son
added.
alimentos
So
naturales,
if
no
these
hay que
are natural
regular, ¿no?
food,
Ellos tienen
natural
el
foods don't
contenido
need to be
de nutrientes que
regulated.
tienen.
They
Y
have the
más
nutrients that
importante,
they
la gente
naturally
consume alimentos
have,
frescos o
and
mínimamente
people
procesados en combinación, ¿no?
can
Nadie va a comer
consume
una
natural
manzana o
food
una
or
banana solamente,
minimally
sino que
processed
van
foods in
a
combination.
mezclar con otros
No one
alimentos.
eats a
Y lo
banana
mismo para
by
los
itself. They
ingredientes
may combine it with
culinarios.
some other
No,
food.
no
The same
habría
can be
por qué
said of
delimitar
cooking.
niveles críticos de
So,
grasa para el aceite, ¿no? Porque el
you
aceite es
don't
100%
need
de grasa.
to
Y
say
para la
that
sal, para
cooking
el
oil
sodio,
is
para la sal, el
100% fat,
azúcar, para el
because it
azúcar.
is.
Entonces,
And you can say
los
the same of sugar.
ingredientes
Sugar
culinarios
is
o los
sugar.
alimentos frescos y
So
mínimamente
culinary
procesados no
ingredients
son
or
involucrados
those
en el
minimally
perfil.
processed foods are
¿Y
not
por qué
involved in the
eso?
profile.
Porque la
Now, why is that the
orientación a los
case?
consumidores
It's
sobre
because the
alimentos
guidance
frescos
to
o mínimamente
consumers
procesados,
regarding fresh
ingredientes
or
culinarios
minimally
procesados,
processed
son hechas por
foods
guías
or
alimentarias.
culinary
Las guías
ingredients,
alimentarias
they
que van
follow
a recomendar que la gente
nutritional
combine
guidance
diferentes tipos de alimentos
so that
frescos o
people
mínimamente
are going to
procesados
be able
y que
to
utilice
combine
cantidades
fresh food,
pequeñas de sal,
those that are
de
minimally
sal, de
processed,
grasas o
and
de
they will be
azúcar.
able to use small
Entonces,
amounts of
estas dos
sugar or
características me
salt
parece
or
que
fat.
son
So
muy
those two
importantes
considerations are tremendously
de
important,
lembrar en este
and
momento.
I think that it's important to remind ourselves that they exist.
Fabio, if you allow me, I would like to ask Ben McGrady. There is evidence that unhealthy commodities industries such as tobacco, alcohol, ultra-processed products operate to weaken regulations, or sometimes just to delay the adoption and implementation, or even block the regulations with different legal challenges when those regulations are approved or implemented. In your experience, when countries in our region adopt parameters and standards recommended by PAHO and WHO, for instance, such as the nutrient profile model of PAHO, how do you think that help them to protect public health and defending themselves from legal challenges? To you.
Thanks very much for the question, Alejandro. And just before I answer, let me add my congratulations on the document. It's an extremely useful resource, and I can tell you from the WHO side, we're already using it in other countries outside of the Americas region to help them advance their work, not only on front of pack labeling, but also looking at how that fits within broader policies. So congratulations, it's a very useful document, I think, on the global level, not just for the Americas. To your question of relying on guidance, starting with the tobacco control context, we've seen a lot more litigation there by companies challenging governments than we have in the context of healthy diets and obesity prevention. And we've consistently observed that where governments are basing their interventions on WHO guidance, PAHO guidance, official documents of these organizations and official recommendations, they're in a stronger legal position. Now, the overarching reason for that is that in most legal challenges relating to public health measures, where the rationality or reasonableness or proportionality of a public health measure might be questioned, that the best defense is always best practice. That is, put in place the best practice public health interventions that you know are going to work based upon the available evidence, and you will always be in the strongest legal position. Now, that best practice is captured in the WHO guidance and in the PAHO guidance that we're discussing here today. But above and beyond that, we've also seen in litigation before international courts, as well as before domestic courts, that courts take notice of the recommendations that PAHO and WHO make, and they rely on those recommendations and the scientific evidence that underpins them in litigation. I can give you a few examples. Uruguay had an investment treaty arbitration with the tobacco company Philip Morris that lasted almost 10 years concerning the country's implementation of the Framework Convention on Tobacco Control, and specifically large graphic health warnings. In the decision, the tribunal, the international arbitrators, relied on the WHO FCTC, its guidelines, and also briefs filed by WHO and PAHO in the dispute. We've seen the same thing recently in the World Trade Organization, where tobacco plain packaging has been challenged, and the appellate body and WTO panel relied on the Framework Convention on Tobacco Control and its guidelines in finding in favour of tobacco plain packaging, the public health measure. And we've also seen this before domestic courts, where they take into account a country's international obligations in order to adjudicate questions under even their domestic law. So I think in a legal sense, in short, following the guidance from WHO and PAHO puts governments in a stronger legal position. And in this instance, as Professor Montero said, the PAHO nutrient profile model, it's built upon the WHO nutrition guidance, and it implements WHO's maximum thresholds for consumption of different nutrients of concern. So it's a very solid basis and really does strengthen the legal position of governments as they move forward.
Thank you. Thank you, Ben, for really clear answer and highlighting the importance of guidelines and importance of international law and international guidelines in the international arbitration, international litigation, and also domestic litigation. Guillermo, quisiera tocar otro ángulo
Guillermo, I want to bring
diferente,
up
pero
another
similar también como
angle.
estrategia
It's
por parte de la
different, but it's
industria
similar.
al que le acabo
And
de
it
preguntar
has
a
to
Ben.
do with the
En muchos países se
industry.
escucha con
In many
frecuencia
countries,
desde
we
el ámbito de la
often
industria, de las
hear
empresas
from
y
the
las
standpoint of
asociaciones que
industry,
representan a la industria, que la implementación de regulaciones para proteger la salud pública, como el etiquetado frontal de advertencia, podrían resultar en un colapso de la economía de un país o de una provincia o de un ámbito local, un estado local, y que además esto podría impactar, por ejemplo, en una masiva reducción de empleos o retrocesos en el desarrollo. Sería importante escuchar de tu experiencia y de tu saber qué nos dice en realidad la evidencia sobre el real impacto de la regulación de productos insalubres sobre la economía y el desarrollo. Paso hacia ti, muchas gracias.
Mil disculpas, mi nombre es Manuel Calvi del equipo de
My name is Manuel Calvi.
Ahí tenemos problemas con
We're
el
having
audio,
problems with our audio.
Y please don't translate. Es importante que seleccionen el idioma en que van a hablar y escuchar, porque si no se mezcla el idioma, su intervención con la del intérprete, y está ocurriendo y la audiencia no puede entender lo que se está hablando. Doctor, si usted podría seleccionar en la cajilla, en el icono del mundo, en su idioma en español. Doctor Paraje, yo creo que usted ya lo seleccionó, ¿verdad? Y el que no y el profesor Carlos también, si es tan amable de seleccionar su idioma español en el icono del mundo, para tratar de evitar este problema de que no se entienden las intervenciones. Muchas gracias. ¿Lo encontró, doctor? ¿Sí? Ok, perfecto. Vamos a continuar. Esperemos que todo salga bien. Adelante.
Bueno, muchas
Let's
gracias
continue. Okay, well, thank you very much for your question. Indeed, that is a very typical tactics used by not only the food industry, but alcohol or tobacco. You know, when try to regulate it, they start, you know, mentioning the economic collapse or job impact, which has been proven over and over again not to be the case. Now, in the specific case of front of package labeling on food, the first country in the world to apply this black seal system, such as the one that we're using more widely in the region, was Chile. And when the discussion took place, which lasted a very long time, there was this ongoing threat about job loss, economic impact, etc. A team of researchers and myself just concluded an assessment on what happened when the front of package labeling was passed in terms of jobs and actual salaries. It's undergoing the peer review process right now, so hopefully it will be published soon. But the findings are that the impact was zero, no job loss, no salary loss, and actually the trends that we had before implementing that labeling, even way before that, were kept. So we compared industries that would eventually be impacted because of the type of product that they would with industries whose products were not impacted by labeling. And basically, those trends were pretty much the same before implementing the front of packaging labeling and continue to be the same. So basically, there was no impact on jobs or salaries, which only makes sense. It's what any, like freshman economics student could say. Why? Because people that decide as a result of this front of packaging labeling decide to stop buying products that have such seal. They use that money to buy other products and food that have no labeling. So there's no job loss. It doesn't impact employment. So again, this has been proving over and over again, not only after implementing this labeling, but also with taxes. When we taxed sugary drinks in Mexico in 2014, we showed that it did not result in job loss because again, if people are not willing to pay those taxes and they stop buying those products that are taxed higher, they move on to different products. And often enough, what we see is not even the companies lose money. These sectors are dominated by small companies, by a few large companies, and the companies that have presence in these sectors have a wide range of goods, some that will be impacted by front of package labeling and some others that will not be impacted at all. So not even these large companies or group of companies will be losing anything. Another thing that we see and that we saw in Chile is that companies that at the beginning start scaring people about all these things, once front of package labeling is implemented, start cooperating and actually start taking advantage of the fact that some of their own products do not have the black seal or the front of package labeling as an advertising strategy, which again contradicts this discourse that, labeling doesn't work, that consumers don't pay attention to it or don't understand, and that's not the case. The companies use the seal-free products as an advertising campaign or strategy, which shows in itself that labeling is effective when it comes to informing consumers. And to conclude the question, basically, all discussions on the economic impact have to begin with the fact that market economies, like all of the economies in our countries, work based on having informed consumers. So the basic assumption for our market economies to really have socially acceptable outcomes is for consumers to be informed. So it is never a bad idea to have consumers informed, in this case, of what they're eating and what kind of nutrients the products they're buying have. Thank you. Thank you, Guillermo. And maybe Dr. Acevedo could speak a little bit, like Professor like Guillermo says, about the economics. The economy goes much farther than fatty foods or sugary drinks. There's other sectors in our trade. So could you speak a little bit about how the industry and trade and the economy in general was impacted, and also the impact on jobs and what you saw in Mexico? Thank you. It is still too early to know whether there's going to be some kind of impact in our Mexican economy. But I agree with Guillermo's takeaways. When Chile implemented their labeling, and they have a longer time doing this, I'm assuming we're going to see the same trends. But I could say that at the macroeconomic levels, the impact has to be relatively minor because there is a substitution process going on among consumers. So if we achieve the desired result, that is to say, when a consumer sees a product that has several octagons, stop buying that and they switch to another product, then that substitution, that change at the aggregate level should have a very low impact or no impact at all. But I believe that there is an impact at the company level. That is to say, if a company focuses on making very unhealthy products and they don't have a lot of diversity in their products, well, that company will probably be this reduction in their sales and income, and it could eventually impact job security in the company. But like Guillermo said, especially the companies that are global, that are in the food sector or in the soda drinks market, these sugary carbonated drinks, these are multinational companies whose portfolios also include water. So there could be a clear substitution there where even from a financial point of view, more likely than not, their bottom line should improve, because if they substitute those drinks with water, then the profitability in water is much higher. So their bottom line should be much more positive. And also, let's think about a population that stops buying certain products altogether and with no substitution. For example, there is nothing they buy instead of that, and so the economic resources those consumers would have used are saved. So when they save, that translates it into resources that can be available in other sectors of the economy, so that could in turn lead to economic growth. I believe that the most important element that I would like to share with all of you is that the front of package warning system has a very clear objective, and that is to change the formulation in products. And that opens the door for innovation to reduce the content of critical nutrients and move towards a much healthier market, which from the point of view of our office is a market that will be much larger economically in economic terms, and it will result in better results for the consumers and the producers. And I could give you an example. For example, this front of package warning where we want product to have more content from natural products. For example, to have orange juice be made out of oranges instead of sugar and flavorings. In the case of milk or other products, can also result in benefits for producers in the agricultural and farming sectors. Excellent. Thank you very much, Dr. Acevedo. And along these lines, that is to say, I acknowledge that we have a positive impact not only on health, but also for the economy and our industries, because that will create different stimuli and incentives for other sectors, like you said. But one of the things I wanted to ask Guillermo is the following. Sometimes, even though we know clearly that the economy will not suffer from regulations, but rather they will be useful to correct these market failures, protect public health, and on the contrary, they will improve economic growth in our countries. Sometimes, in some contexts, there's arguments to the fact that if we are a very small country or a province or a state that is highly dependent on, I don't know, sugar production or the manufacturing or exporting of high sugar content processed foods, then we're going to have issues. So, Guillermo, could you speak a little bit about what can you say when we hear these type of arguments? Well, again, based on my experience, and this is not only in the area of food regulation, but tobacco as well, for example. First of all, that's an argument that's used way too frequently. Then all the countries think that they are unique, that what their neighbor did cannot be applied in their country for some reason. And in fact, the arguments that are used to discredit these type of policies are pretty similar, and they have the same conceptual fails. First of all, before answering, I must say that the industry uses small farmers. That is to say, they take the small farmers to the street so that they protect the big companies' interests, which is regrettable, honestly, especially when those industries, oftentimes in small countries or small provinces or small regions, basically take advantage of their market share, and they take advantage of these small farmers. These are industries that are pretty much monopolies in terms of being the small farmers' clients, and the conditions they set on farmers or raw material providers are very stringent. So it is quite cynical to have these same big companies or industry come out and say that these policies will actually harm those small farmers. Now, in cases where we have provinces that have a strong presence of one of these raw materials, we need to take into account that in the long run, If the producers were to truly, the small producers were to truly suffer, the government, for the greater good, which is to improve the health of the population, can definitely step in and develop practices or policies to support these small farmers so they can have replacement crops. What we cannot do is to be hostages to this alarming discourse by the industry, where again they use these small producers, these small farmers that they take advantage of on a pretty regular basis, and they use them as an excuse to prevent these reforms. These things are discussed on a regular basis. For example, when we deal with tobacco control policies, and we have to do it. The greater good in this case is public health. So we can implement policies to provide support to this sector so that in the long run they will not be impacted by the consequences, if such consequences were to exist, which is again pretty questionable. Thank you, Guillermo. And now stepping away a little bit from the economy and agriculture and going back to the dinner table, sometimes this discourse that focuses on one aspect of the agriculture becomes also an argument to focus or question that one aspect in nutrition. So, Carlos, could you talk about these arguments that oftentimes we hear when we say that the issue with poor nutrition and health-related issues as a result of poor nutrition are a result of the sugar that you put in your coffee or the excess salt or oil that you use to cook at home versus processed or ultra-processed foods with excessive amount of those critical nutrients? So what does the evidence say about this? It's interesting. Latin America has excellent data on this issue because we have a lot of countries with national food and nutrition intake. When we look at these surveys, it is very easy to conclude that if people were not to eat processed or ultra processed foods, that is to say, if we take the part of the diet where they have real food, fresh food, and minimally processed food, and cooking ingredients, salt, sugar, fat. Nutrition wouldn't be perfect, but it will be much better than what it is today. So, and this has been proven in Chile, Argentina, Brazil, Colombia, and Mexico, at least. So, all of these countries show that the excess in sodium, sugar, total fats, and saturated fats, and trans fats is a result of the portion of the diet that comes from processed and ultra-processed foods. So, and that is why PAHO's profile is so important, because it regulates the amount of those critical nutrients that should be present in those products. I saw really interesting comments from the panel, and I found one question interesting. They're asking, why does PAHO's profile use recommendations from the from WHO that are for individual food and diet? This argument would be very good and very valid if PAHO's profile was applied in all kinds of foods, and that's not the case. Like I said, the profile applies to food that the industry makes with these added critical nutrients, and they're products that are ready to eat and that people eat either by themselves or just a soft drink or together with other processed and ultra-processed foods. So the validity of extrapolating the diet recommendations to individual food is very relevant, because the probability for our diet at the end of the day to be below critical levels increases if people do not eat processed or ultra-processed foods that include an excessive amount of these nutrients. There's another question that says that in Mexico, a soft drink that has 2 grams of sugar per 100 grams of product it has a seal, and that's the way it should be, because it has 100% calories coming from sugar. It has no other nutrients. So obviously 100% of the energy coming from sugar does not make for a healthy product. Another important thing is that PAHO's profile and front of package labels do not ban food production, and they are not telling people that they should not buy those products at all. It is simply informing the consumers that if they were to eat these products, this one or that one or the other one, at the end of the day, more likely than not, their nutrition will have excess sodium, saturated fat, or sugar. So it is guidance, and I believe it is a very relevant guideline. And one final thing, or one additional thing, there was a question about saturated fats, saying that there's evidence today that saturated fats should be considered fatty acid that are specific, or that it depends on what product it is. It's a very controversial issue. But like I said before, WHO's guidelines for saturated fats today says that 10% of the total diet is the maximum value. But like I said before, if WHO modifies that, then the profile will reflect that. And in the case of saturated fats, like you know, the group that I belong to at PAHO is very close to issuing new recommendations, and systematic reviews have already taken place, and there was even a public consultation, and the document that went to public consultation was evidence-based, and it still suggests the same 10%. But like I said, if science changes, if evidence changes, then PAHO's profile will change as well. Otra vez hice lo mismo.
Thank you very much, Carlos. I'll ask, given that you mentioned, the several policies. I mean, this is not about just putting in place a warning label, but also how other policies can benefit from such regulations, such guidance for the public. And I wanted to hear from Holly Wong. As the Global Health Advocacy Incubator is devoted its work to supporting policies to promote and protect healthy eating and prevent obesity and other diet-related conditions. We know that a lot of experience and evidence on concrete solutions have been accumulated in the region, but there's still a lot of countries that have not adopted effective policies. And as it was mentioned before, we need to go. The warning labels are very important, but there are other policies that are also necessary. So why do you think warning labels are an essential policy tool, and how it can help to connect to other essential policies?
Great. Thank you, Fabio. And before that, let me just say congratulations again to PAHO for this publication, which will be tremendously useful for everybody working to improve diets around the world. As you note, the experience and the evidence about concrete policy solutions to promote healthier eating have been growing, and we see a very positive trend of more populations demanding such policies and more governments being willing to implement them. So front of package warning labels are one of those policy solutions, but we can't view those as a magic bullet. They're not going to solve some of the healthy eating and diet-related problems that we see by themselves. These front of package warning label systems have to be part of a broader package of complementary policies that support each other and work together. So they can be connected to other policies, for example, tax policies that work to discourage the consumption of unhealthy products, which could include, for example, sugary beverages. It would include policies that restrict the availability of unhealthy products in public sector environments, and particularly in schools for children, our most vulnerable population. And they can also include policies that restrict the marketing of these unhealthy products, particularly to children. These policies would work together to create healthier food environments to address the epidemic of diet-related diseases that we have. But one of the reasons why the front of pack warning labels are particularly important is because they're founded upon the nutrient profile model. The nutrient profile model, which lays out the criteria for which products are considered healthier and healthier. And those criteria and the nutrient profile model itself would be important for the other policy solutions as well, and support those. So for example, based on the nutrient profile model, you can identify which are the unhealthy products, and those perhaps should not be available in schools, and those should not be able to be marketed to children. So having the nutrient profile model along with the front of package warning label system is really an important step to helping us move forward to establishing the right kind of environment for healthy food policies. Thanks.
Muchas gracias, Holly. Me gustaría hacer una
Thank you very much, Holly.
hacer una pregunta al
I have a question for Senator Cobos.
en su experiencia y
In your experience, Senator,
que usted ha hecho conjuntamente
and taking into account your efforts along with Ms. Sogasti, leading to approval in the Senate of Argentina of these measures. So in addition to congratulating you on your efforts, could you tell us a bit more about whether or not you
debilitar ese esfuerzo para
had to deal with any attempts to weaken your efforts when you tried to move that bill forward? And what could you tell us? What was helpful to offset those potential attempts to stand in the way of these recommended standards?
Muchas gracias y le paso la palabra.
Thank you. Well, thank you and good afternoon, everyone. Thank you for this opportunity. This is a very interesting meeting, interesting for our country, but for the entire region. The truth is, right from day one, when we presented our bill, and that was 5 years ago, almost instantly, and in this case, I represent one political party, Senator Sagasti represented another party. We were the official party. They were the opposition. Now our roles have changed, they're opposite, but this had to be a state policy. This is an important state policy, not a party policy. So we had to make an effort to garner support. So I was saying that this happened on day one because what I've heard here so far is what we have been repeating in each country. We see that the problems we experienced are being repeated elsewhere. We had strong support from the Ministry of Health, but there was a bit of doubt raised by industry. That is something that we have been able to deal with here in Argentina. And the arguments are always the same, that we are satanizing food, that it's going to lead to a loss of jobs, that here in Argentina, what we've had to do is coordinate with Mercosur. So that is the soundest argument that is still left, because we have been able to tear down the other arguments. So the truth is, we all have to work together, and especially we are very interested, and we closely followed the project in Chile, and then we came to a format that is quite similar to theirs. but in terms of the wording, et cetera, we have also been piggybacking on what Mexico did. Now, in Argentina, we have a two-chamber legislature. Now this goes to the House of Representatives. The sugar industry is a big monopoly here in our country, and also pressure from the food industry, and also the entity that represents the food industry.
A usted para preguntarle sobre el tema de diputados.
Thank
pero
you, Senator. I'm going to be coming back to you to ask you about the House of Representatives, but
I would like to take the opportunity to ask again to Holly, in your efforts to support the advancements of policies to regulate processed and ultra-processed products, what are the main obstacles you have identified? And how do you think that this publication could be helpful for public health advocates in overcoming such obstacles? Thank you, Holly, to you.
So I think what we've seen in many of the countries around the world where we are working with our advocacy partners is often the greatest challenge to advancing policies to create healthier food environments is opposition from the ultra-processed food industry to these policies and their ability to influence policymaking in their favor. So industry is a stakeholder in these policies. There's no question about that. And they should have an opportunity to provide input into how these policies are implemented. But I think it is a different matter to have them telling policymakers how to protect public health or not, when their products are actually contributing to the diet-related diseases that we see today. Now, I think the tremendous value of this publication, to be very honest, is that you have identified the main arguments used by industry to oppose these policies very often and have debunked those arguments or shown that they are myths. And you've provided the evidence and the clarity that many of those arguments are just not valid. For example, arguments that front of pack labeling systems would violate trade agreements. Or that voluntary rather than mandatory labeling systems would work. I think the evidence that you've shown in the report is to the contrary and helps identify that those arguments don't really hold water. So I think that this publication will be tremendously valuable to both public health advocates and to policymakers as they're trying to move forward policies like the front of pack labeling systems and others to protect public health.
Thank you, Holly, for the clarity of your words. And voy a aprovechar entonces con esas palabras para pasar a...
So I'm now going back to Senator Cobos. I told you that I was going to ask you about replicability of what has been done in Argentina. I know that Argentina has passed this legislation, that there are standards in terms of labeling, advertising in schools. But as you said very correctly, Senator, right from the start, there were attempts to stand in the way of the success of this bill. There have been different arguments brought up to contradict the effort. But my question now to you is, in your political experience, what do you think other representatives are thinking? What other obstacles do you think may be raised? And this type of publication, this type of meeting, is there anything else that could be useful to offset that effort? I would begin by responding to your last remark. This type of experience is very favorable for us, and it does give us elements to defend our efforts. This is not just something that was invented by two political parties. We are working together to promote this change. So we do have the political elements in place. Now, in our countries, there is always regionalism. Our countries are large, and there are different interests represented by our legislators, and they are contacted by representatives of industry, as we just described. We had a problem because our regular session in Argentina concluded. And unless the president postpones our regular session or call a special session, we wouldn't be able to session. Now, we were told that there is going to be a special session, and we insisted that this issue be included. And the president, Alberto Fernandez, did include it. So it has to be discussed in the House of Representatives. I don't know if that will be December or January or February, but at some point it will be discussed. The only thing that I am perceiving, because I heard someone in the foreign ministry say that this needed to be postponed until Mercosur reached a decision. We have said no. Uruguay, which is a founding member of Mercosur, now as of March 1st, is implementing a similar measure. Chile, who acceded to Mercosur, they, for a long time now, more than 5 years ago, they have established a similar system, as has Mexico. So in the law, we included an article saying that this has to be ratified by the Congress of Argentina. So there is a possibility of amending the law if there is consensus within Mercosur in terms of regulating something having to do with the labeling law. But we did not want to leave this up to Mercosur for decision. So we feel that we should regulate what is done in Argentina, and then hopefully if several countries do the same thing, this can be standardized. We cannot be too optimistic because until this law is passed by the House of Representatives, and since here we have two chambers, one chamber reviews what is done in the other, and that is the way it's supposed to operate. But we want to make certain that these changes will not affect the warning system, because consumers have the right to be well informed when they decide to consume a processed product. Thank you. Thank you. And this is good that you clarified how the bicameral system works in Argentina. And thank you for telling us about your dealings with this bill.
Ben,
very well.
You have paid attention to what the senator has mentioned. And then I would like to ask you, I mean, in countries, like this example the senator has mentioned, many people opposing to this kind of public health policy argue that the country should not take action before harmonizing this regulation with commercial partners or integration regional mechanisms. Do you see, in your experience, any legal commercial impediment that prevents a country from taking action and improve and implement legislation or norms, like from packaging warnings to protect public health? I mean, we just saw the example of what the senator from Argentina is mentioning us as one of the concerns in relation to the Mercosur, the regional agreement in South America. To you, thank you.
Thanks, Alejandro. No, I think the answer is to take action and to take action now, in short. And the reason is that in the Mercosur context, as we've already heard, Uruguay and Chile have moved forward. And they've moved forward because they have a right to regulate to protect the health of their population. They have a right to take measures that are necessary to protect public health. And this is a well-established principle, not just under the law of Mercosur, but other international trade agreements, where they've been interpreted quite broadly to allow governments to regulate in the public interest and specifically to protect health. In addition, as we heard from the senator, each country has a right to determine its own level of health protection. And in order to do so, it needs to move legislation forward now and then consider the merits of harmonisation later, rather than have a conversation now with other governments about what level of health protection is appropriate for Argentina. That's just passing decision-making and taking it out of the hands of the national parliament, the elected legislators, and putting it in other people's hands. So no, as I said, I think the answer is to take action and to take it now, but also to recognise that harmonisation in the international trade context, it doesn't happen in a vacuum. It happens after governments have already moved forward and implemented different systems, and then they consider whether or not those systems can come together and in a harmonised way without reducing the level of health protection that the governments are seeking to implement. So it doesn't happen against a blank slate. It doesn't happen in a vacuum. It happens where governments have already moved forward, as we've seen in Uruguay and Chile, and I'd encourage Argentina to do the same.
Thank you, Ben, for your clear answer and for connecting the comments that was previously made. Juan, te hago una pregunta que es obviamente
I'm
muy
going to
cercana.
ask you a question that is important to me as a regional advisor for human rights. We have gone through different arguments. We heard about evidence, practices, the role of the publication. We saw a good example in Argentina, where we talked about the role of parliament, the pressure from industry, different elements, and all of this has been contradicted by the evidence we have. But there is a question from another angle. We all know that all the countries in the region have ratified, and they are party of the human rights treaties. Our region is one of the most active in terms of ratification, even putting human rights into their constitution, giving them prevalence in our law. So our discussion on FOPL, what do we think from that perspective? What are the obligations contracted by states when they ratify these treaties? So they have to abide by those obligations. And when we think of the role of industry, they're local or transnational, what are their obligations? So I wanted to ask you that question.
Thank you very much, Alejandro. Before answering, I would also like to join in the congratulations on the publication. Working at the regional level, having a publication like this that's so clear and such a matter-of-fact and evidence-based perspective is very, very high. Now, in terms of the question that you asked, I believe that that's the other element that supplements a lot of the comments that were made here today, both in terms by Senator Cobos as well as by Holly a few minutes ago. I think that refers to the capabilities that states have to determine their level of protection, and it needs to be understood together with the obligations that you mentioned. From the point of view of international human rights law, when human rights agreements are ratified, the states take on certain commitments. Specifically, there's an obligation that's the duty to protect, which is also including the right to health and the right to food, which basically says that governments are required to ensure that third parties will not negatively impact the possibility of a population to enjoy the right to health or right to nutrition. So from that point of view, I believe that the straightforward action is that inaction in this context is a violation of human rights obligations. And I'm going to talk a little bit more about some of these aspects because clearly those agreements have a very general perspective, and over time certain developments take place and they lead to interpretation standards regarding what we understand about what we understand by the duty to protect and respect human rights. Now, in terms of the right to health, for example, recently the UN outgoing rapporteur for human rights said something about FOPL for hypertension. And in that statement, the outgoing rapporteur said that such labeling is in line with human rights obligations, especially the one that stem from the human right to health. He also refers to a lot of things that are aligned with what was said during this event today. And he also concludes that the efforts need to be mindful of efforts by the industry actions aimed at impeding government action. So the action have to be aware of this interference and ask accordingly. Protect from conflict of interest in public related matters. So I wanted to highlight this. A UN outgoing rapporteur that works on the human right to health decided to spend some time and resources to warn governments that this specific, FOPL policy is necessary from the point of view of human right obligations. Another important aspect of that statement is that refers to the importance for all actions to be based on scientific evidence. A lot of comments were made around the fact that at this time, evidence supports warning or front of package warning to address the critical issue of obesity and overweight. And this also goes back to the goal the industry plays in creating uncertainty and casting doubt on clear scientific evidence that is unequivocal in the sense that these regulatory measures must be applied. Another aspect that I wanted to highlight is that over the past 5 to 10 years, there's been a very strong movement to try to analyze the impact that international or multinational companies have on human rights. So we're working on a specific treatment on companies and human rights, and there's been several reports at the regional and global level analyzing that impact. There are different statements and general recommendations from the Committee on Human Rights that say that the strategies used by food and drink companies impact human rights and specifically impact children and adolescents. So that makes it even more urgent for the government to address this issue to ensure that the decisions that are made are in the interest of health, which is basically what these type of actions aims at doing. That is to say, to make it easier for consumers to make decisions that advocate for health. And finally, I'd like to conclude by saying that in general, the human right treaty compliance level include reporting mechanisms. That is to say, they provide for those mechanisms, and there's independent committees that express or voice their concerns, and if warranted, they issue recommendations. And at that very specific level, human rights committees are also starting to issue recommendations to specific countries in line with the topics that have been addressed during this event. For example, the Committee on the Rights of the Children, during their observations on the human rights situation, and more specifically the right of children in Colombia, it refers to their concern about the impact of human rights by companies in Colombia. And in the reporting period for Argentina, which is discussing this bill, there's also a concern on the obesity and overweight situation and in Argentina, and there's a specific recommendation to favor front of packaging labeling and related measures. So this reflects what I said at the beginning, that is to say that there are general and specific developments and specific recommendation to countries that at this time and with the level of evidence that we have proved that front of package labeling is a necessary action to comply with human rights obligations. And that is why inaction means non-compliance. And therefore, that should also be part of the analysis of how other international right obligations play out. We talked about Mercosur, but here there's a specific obligation at an international level. And like you said, Alejandro, in your question, several countries in the region have this at the constitutional level. So from that point of view, it's also a very valuable element to understand how urgent this is and how we can support these types of decisions. Thank you. Thank you very much, Juan. And I just wanted to reiterate what you stated so clearly. This answers part of a very complex question that has been asked at the public law level, like to say international human rights law and public law is between and among states, but individuals or groups of people may use them to feel that their rights have been violated. But what happens with companies, especially in multinational companies? So these developments show that the role that governments have in the country, regardless of whether it's a national or international company, they have to regulate the way they do business and they do marketing in their own territory. And like you said, the committee has started issuing recommendations along these lines because General Observation 16 on businesses and the rights of the children is saying that it is the government's obligation to regulate business-related activities in order not to violate children's rights. And it specifically mentions tobacco, maternal milk substitutes, and unhealthy food. So little by little, we see that there's an evolution around this concept that companies, regardless of whether they are domestic or international, must be regulated at the local level in the way they do business, in the way they label, in the way they market their products. And that is a significant progress. And I think we'll see more and more of this because, like you said, because of the rapporteurs and because of the committees, there will be direct recommendations made to countries. And the countries that have human rights agreements or treaties at the constitutional level, this could go above and beyond the regional framework, such as in Argentina, which in our Article 75 in the Constitution, we say that the Commission on the Rights of the Children has constitutional rank. So this is a very relevant comment. Fabio, the floor is yours. Thank you very much, Alejandro, and thank you much, everyone. We're not now going to have some time to reflect upon some of the questions that we received from our participants, and there's a lot. So we're going to try to answer as many as possible. But I would like to begin with a question that is linked to what we just heard from Juan and Alejandro. And once it deals with one has to do with the government's obligations, government role, and other mechanisms where we have international standards. So with that, I would like to address the question to the WHO, Dr. McGrady. In one of the questions, it says, why are countries are following their front of package labeling actions without support from Codex Alimentarius? So basically, we would need the Codex to support the country in order for the country to move on with their public health protection measures, in this case, front of package labeling.
Fabio, so if I've understood the question correctly, it's why are governments moving forward without a codex standard on this issue? Yeah. Okay, so at present, there's an ongoing process in Codex for negotiation of additional guidance on front of pack labeling. But I think on average, it takes around 8 years to negotiate a codex standard, guideline, or recommendation. And so there's obviously substantial delay if you're to wait for codex. But also the negotiations so far suggest that they're not going to lead to a single global standard for front of pack labeling, but instead they're going to recognize that different countries will use different approaches and try to establish common principles for front of pack labeling. And we've already seen, I think, in those negotiations, very active participation from countries like Chile and countries in the Americas, where the warning signs are advanced. And I think it's also important to recognize that there's a few countries in the world that have mandatory front of pack labeling. And so as a consequence, their participation in the codex process and their influence over the codex process is quite strong because they have quite a strong interest in it. So I think that the two key points are, first of all, the process of negotiating standards, guidelines, and recommendations from codex is very slow. But second of all, what's ultimately negotiated is just likely to be general principles. And because of the interests that countries in the Americas have, specifically in warning labels, it's reasonable to think at this stage that those principles will allow space for governments to implement those types of measures. Even so, Codex is not binding. It's not an international treaty. It doesn't force countries to implement Codex to the letter. They're standards, they're guidelines, they're recommendations, and governments can still go above and beyond them under their international trade commitments, where implementing the Codex standards would not be an effective means of achieving the level of health protection that a government chooses. So there are many reasons, given the urgency of the obesity problem in many countries, given the legal situation, there are many reasons why governments would continue to move forward while the negotiations at Codex are happening. Back to you.
Thank you, Ben. And I just wanted to flag for all participants that this is one of the questions that has been addressed in this document, highlighting, as Ben mentioned, that Codex is not it's not an entity that's flying above you, all countries, and we've also heard comments from country representatives in the chat indicating that all countries should take part in sharing their experiences, and actually countries are the codex. There are countries that are the ones that establish the standards based on their experience and their expertise. So and the evidence. So we're all building codex when we're moving forward with your policies. When the countries are taking action, the whole world is learning from it. So just to highlight that this is something, one of the things that we've also covered in the publication. Now there's one question that I may ask Carlos to address. One comment that says, if a product has 2 grams of sugar per 100 grams of product, or 100 grams of milliliters of product, that would mean that this product's very low in sugar, but it would still be considered high in sugar or excessive in sugar according to the nutrient profile model. So I'll just make the first comment here, and then Carlos could also come in just to separate, not necessarily if it's 2 grams per 100 gram of product, it will be excessive in sugar if it has other nutrients. So it's a balance, it's a need to be balanced in the product. So, but let's hear from Carlos, what if we were using, and why a product that's only 2 grams per 100 milliliters or 100 grams of product could still be excessive in sugar, for instance, even if by 100 grams or 100 liters, it sounds like it's not too much, right?
Sí, gracias. Bueno, yo vuelvo otra vez a la...
Thank you. Well, I go back to the PAHO profile issue. That is to say, it extrapolates the individual products, our diet recommendations. And why do we do it? We don't do that for all foods, but for those that have added sugar, salt, or fat, and that are processed or ultra-processed. So this food follow the diet guidelines. Why? Because the probability or the likelihood of having less than, let's say, 10% of sugar out of the total amount of calories to achieve this average of less than 10%, then the large majority of the food must have less than 10%. If one individual food has like 100% of calories coming from sugar, in this case will be per 100 grams of product, the likelihood of having excess sugar at the end of the day, if we put together all the food, increases exponentially. And that is why the profile identifies this one product as excessive in sugar. Another interesting aspect, and I saw some comments about this, it said, well, but if we follow PAHO's profile, then we will have about 90% of our product or ultra-processed foods will have the seal. Well, that is an additional argument, because if 90% of the food that are processed or ultra-processed have over 10% sugar, for example, then that means that we must avoid those foods. Let's imagine a situation where we have a person that whose over 50% of their calories comes from processed or ultra-processed foods, which is not rare at all. It happens in Latin America all the time. Let's say that somebody has about 60% of their calories coming from processed or ultra-processed foods. We know that these products, like 90% of them, have over 10% sugar. Well, this means that it's almost impossible for this one person to, at the end of the day, to have less than 10%. It's like saying, well, I used up my sugar intake with all the processed and ultra-processed food, so I'm going to make my meals with no sugar, no salt, no fat, which is absurd. So what happens is that really 90% of processed or ultra-processed foods have excess sugar, sodium, or fat. Is then either the industry has to change these products, or it will be very hard to include these products as part of a healthy diet. Which means that people would have to make their rice or meat or beans with sugar, without oil, which is impossible.
So what will happen when we apply the PAHO profile is two things. First of all, industry can reformulate some of its products, and it would be good for them to do so. If not reformulated, the solution isn't going to be to not eat, but to eat real food, fresh or minimally processed food, and prepare those foods with culinary ingredients. So that is basically the message that the guidance is proposing in Latin America. So the PAHO profile is well aligned with dietary guidelines. There is no contradiction here. And I'm sorry, but the product that has only sugar in its composition, no matter if it's 2 grams per 100 grams, that is not a healthy food.
Gracias, Carlos.
Thank you, Carlos. Another question, a question that we received, is if the document talks about the use of other types of front of package labeling, for example, the GDA used a lot by industry or other labeling systems. There's a question about those foods that are positive. For example, proprietary statements on content of minerals or vitamins, something like that. That was asked in the questions. Someone else says, why is the warning system focused on the non-communicable diseases? That would be sodium, sugar, fat, so as to reduce the consumption of those products. On another hand, we see an increase in consumption of vitamins and minerals. Dr. Acevedo, perhaps you could comment on that. Is this being regulated in the bill that is being legislated in Argentina? Are you looking at the use of this information? How about a product that has a high sugar content? Could it be marketing by saying that it has added vitamins or minerals or other elements? Because that would show some consistency between saying this is a public health risk, but by bringing in something having to do with real food containing other elements. So I don't know if Carlos would like to comment, or you, Senator. Yes, and thank you, Fabio. Something that you do have to keep in mind is that the front of package labeling as a warning has to be very straightforward, very clear. In other words, in the label, you should not allow for there to be anything that could be interpreted either one way or another, nor contradictory messages. One of the virtues of the FOPL implemented in Mexico is that with great clarity, the consumer in less than a second can see if that product has any excessive nutrient, anything that could produce disease. So the recommendation has to be a clear message that does not lend itself to any doubt on the part of the consumer. I also believe, and this was brought up before, when people talked about the protection for health, I think that from the public health angle, the level of protection of health has to be proportional to the seriousness of disease in our population. Mexico needs a clear label that can be effective in the very short term because of the size of the problem. But as Holly was saying, labeling is a necessary step, but it's not enough in and of itself. We need to take other public action to support the overall purpose of public policy, which is to protect health and protect our economy. And those two things can be reconciled by focusing on how we can eliminate market failures, how we can address this in a structured way, and how we can promote this supreme public interest. Thank you.
Adelante.
Sí.
Please go ahead.
Esto siempre surge en el debate.
This always comes up in any discussion. Why not have a positive label? Just like we have traffic signs, for example, or other things like a Nutri-Score. The problem is labeling is the appropriate tool to identify these nutrients that, when consumed in excess, cause disease. So labeling cannot lend itself to a discussion, to debate. It has to be very direct. And it is direct, saying this specific product has a concentration of these nutrients that are associated with disease, and the level is above what it should be. Now, positive messages regarding fiber, vitamins, minerals, that is a lot more complicated because, first of all, there's absolutely no evidence that the presence of a positive nutrient, say minerals, vitamins, fiber, there's no scientific evidence that the presence of that positive nutrient is going to offset the negative effect of the rest of the contents. So something like the Nutri-Score, you could think, okay, I am consuming a good nutrient, so I can afford to consume the bad nutrient. No, excess sodium is excess sodium. If there is fiber, if there's vitamins or minerals, you're still getting too much sodium. So this becomes very complicated because the argument is based on looking at the entire diet. I saw some comments saying that the PAHO profile is going to prohibit the consumption of salmon or olive oil. That's not true. Real food, fresh food, those minimally processed basic things like olive oil, those are not even examined. They're not labeled. That depends on the combination in your entire diet at the end of the day, plus the right tool to figure out what food is good and should be part of your diet is the dietary guidelines, because there the combination of food is very important. For example, white rice. That is something that in Latin America is eaten with beans, but white rice doesn't have as much fiber as brown rice. But if you eat white rice with beans, the fiber content is perfect. And I cannot put a label on that. I can't say, okay, this product is low in fiber, but eat it with beans and you'll be okay. That's not what the purpose of labeling is. That is why we have dietary guidance. Also, there is no miracle. Labeling doesn't solve the entire problem, but it does address a big part of it. If you would allow me, and here I agree with what Ernesto Acevedo and Carlos Monteiro just said. We think that labeling should be simple, straightforward. It should bring a warning. And in the law, we say that when a product is on the market, the advertising of it, along with some positive features, for example, fiber, etc., is prohibited. Or using the superheroes. Those are things that try to offset the effect of these excessive nutrients that are causing health problems. So I just wanted to support what was already being said. Thank you. Other questions that we have gotten, but some of these questions have already been addressed. One had to do with Mercosur, or others had to do with other systems. the importance of communication, education. Those are other topics that are covered in this publication, and how interventions of information education are complementary. The warning is an information and communication tool. We have brought them in too. Now, this is taking us to the end of our session. I don't know if any panelist has any comment to make before we get into the closing remarks. My only comment would be to thank you for your invitation, and also to reiterate the urgency of this topic for all countries in Latin America. We need to implement effective, efficient policies to protect both public health and the economy. These two things always go together, and we can protect them both. Mexico is a country with great trade opening, and we have been able to position our labeling, and we have done this in a strategic way. So I'm certain that the other countries of Latin America can do the same. Thank you very much for your invitation. Thank you, Dr. Acevedo. Anyone else? I too would like to express my appreciation and to underscore something that has been said here. Labeling is necessary, but in and of itself, it's not enough. Education, especially in elementary school, is important. To talk about this, we need authorities to take steps to make sure that school meals will be healthy. So our bill envisages all of these topics. And once again, thank you very much for this opportunity. Thank you, Senator. Holly?
I just wanted to add that it's been mentioned many of the efforts that are ongoing, including in Argentina, in Uruguay, in Colombia, to push forward with front of pack labeling. Also in the Caribbean, our colleagues there are working very hard through CARICOM and through the cross-Q standards process. And there is a strong proposal there that's based on the PAHO nutrient profile model. And we're hopeful and working with our colleagues across many of those countries to reach consensus and to be able to move that forward for that region as a whole. Thank you.
Thank you very much, Holly. ¿Alguien más? Anyone else? Bueno, les agradezco a todos.
If not, I wanted to thank everyone. I wanted to thank all of our attendees. And I'm going to turn the floor over to Rosa Sandoval, who is the Unit Chief of Risk Factors and Nutrition, for her to make some concluding remarks. But thank you all. Thank you, Fabio. I wanted to begin by thanking our group of select panelists. I hope that the 400 and some participants who joined us, we had more than 400 people, I hope that everyone profited from this dialogue. I personally found it to be very helpful, talking about different visions. We talked about the executive branch of government, the legislatures, we heard from scientists, and also from legal experts. So this dialogue does not stop here on the part of PAHO. I have two invitations for our participants. The first is, I wanted to thank you for the 68 questions that we have here in the Q&A. We hope that you will check the publications. A lot of the products or the questions in the Q&A are covered by our publication. And then secondly, I wanted to end by reflecting on three things. First, A lot was said about harmonization, and I know that that is a very timely topic when we're talking about harmonizing policies, especially in Central and South America. And here I would emphasize what Ben was saying, and that is harmonization of policies can only be obtained as countries move ahead individually. We think in PAHO that we have individual and regional advances, and we encourage you to continue to press forward. It's important to continue to identify best practices and to find a path towards accomplishing these objectives. Then second, something that was raised here too, and that is the strong tradition of human rights treaties that we have in Latin America. And I think this is important for those of us who work in public health. We have to make good use of human rights. And this is something that Juan brought up, and that is that taking no action actually violates human rights. We in PAHO look at a lack of action. Lack of action, in other words, how much does it cost the country? Dr. Acevedo said that very correctly. What is the economic cost of inaction in Mexico? What is the cost of taking no action? So it's not that by not doing anything, you cost your country less. No, that is my second message. And the third is I wanted to reaffirm the position of the Pan American Health Organization. We always work based on scientific evidence in different fields of knowledge. That is our position as an organization. We know that there is a strategy on the part of industry. They try to create confusion regarding the evidence. It's a strategy. We have seen it in tobacco control. I come from working in that world. So it is so good to work with Guillermo, Ben, Juan, people that we have worked in Latin America together. So to begin by saying that in this effort, this endeavor to establish a regulatory framework that would help consumers to make better decisions. Our slogan as PAHO is to make a healthy decision the easy decision. In other words, choosing healthy food should be easy. There is no one thing that is going to solve the problem. Frontal labeling will not solve the problem, but we know, and a lot depends on special features. We know that we know a lot about this. When we begin to work in these areas, we work on strong interests. And that is important for us as PAHO. It is important for us to reassert our position, to work based on scientific evidence, and in that way contribute by working with governments and legislatures to use that evidence for decision making. So I conclude with that message. We are at your disposal. This dialogue does not end today, and thank you very much for joining us for this session.